Hello and welcome. Our focus of discussion will be on flail chest. I'll be taking you through from the pathophysiology, causes, complications, and management of flail chest. If you're new to this channel, kindly subscribe so that you get the latest update from my channel. Flail chest will happen when we have multiple adjacent ribs breaking in multiple places. What I mean is there is breaking of the ribs around that area, the ribs that are adjacent, and you can also have a situation that we have another area where we have the same. So at the end, what you have is a segment that is left hanging. So what happens is as the chest is moving up and outwards during breathing in, this segment will be moving inward, that is moving in the opposite direction, a movement commonly known as a paradoxical chest movement. Flail chest is typically mostly caused by a significant blunt trauma to the chest, and this can mostly be more accident, and it can be fall from heights and other causes. One of the major complications of flail chest is lung contusion. So you realize that as this person is breathing in, as the lungs are moving up, the segment normally moves inward. So what happens is as the segment keeps on coming into contact to the lung, at the end, a contusion normally develops at the point of impact. So what's the complication of this contusion? So you realize that that flow to that area will be affected, and this will reduce the surface area of the lung, and your patient will easily get into hypoxia because of the reduced surface area of the lungs. The second complication we have is as the paradoxical movement keeps on happening, we can have a situation where the fractured ribs can puncture the lungs, and what happens when the lungs are punctured, air can leak into the pleural cavity, and this can easily cause pneumothorax, and the worst that can happen is tension pneumothorax. Another complication that we can have is flail chest can impair the breathing. So you realize that the end this need for you to support the ventilation. So when it comes to the management of a flail chest, it is much supportive. So what you need to do is you want to ensure that the ABCs are taken care of. You also want to manage for pain. Remember, during that motion, it is very painful. So if the person is complaining with a lot of pain, giving painkillers to this patient is highly recommended. Also, what you want to do is you need to keep on monitoring and reassessing this patient, because tension pneumothorax can develop if the ribs puncture the lungs. If it develops, then you should be in a position to manage that. One thing that you need to note is application of back dressing is no longer recommended.